easier to learn and easier to teach. In 2009, the Priory Group, one of the largest providers of healthcare in Europe, moved away from its then MBA and physical intervention training provider to adopt our system of work. As part of their commitment to quality assurance, the Priory Group commissioned an independent comparative survey from the University of Southampton to compare our system with what had been previously taught and to ensure that what we were delivering was both legally and ethically acceptable. The findings were as follows. 1. The training provided by NFPS Ltd is consistent with all of the legal requirements for training that the Priory is expected to comply with, such as the Mental Health Act, the Mental Health Act Code of Practice, NICE guidance, the Care Quality Commission guidance that highlights staff support, appropriate training, safe services for patients and investment in the workforce with regard to their well-being and safety. 2. With regard to the use of force with children and young people, the training provided by NFPS Ltd complies with all of the legislative requirements and is consistent with the following legislation: the Children Act 1989, the United Nations Convention on the Rights of the Child, the Education and Inspections Act 2007, and relevant guidance issued by various government departments. The training provided by NFPS Ltd is also compliant with all of the relevant statutory requirements in relation to the use of physical force, including common and criminal law and the Human Rights Act 1998. In addition, the training provided by NFPS Ltd meets all of the health and safety legislative requirements, including techniques which are developed and assessed for risk consistent with the Manual Handling Regulations 1992. 5. The 7 techniques provided by the NFPS system of work provide sufficient restriction of patients to prevent aggressive or violent behaviour and were suitable across all clinical areas of the Priory, including secure services, adults, adolescents, acute services and eating disorders. 6. The staff feel supported and are able to cope with the circumstances that may arise in all of the service areas because of the simplicity of the techniques and the legal and ethical underpinning the NFPS Ltd system of work provides. 7. All staff that took part in the survey confirmed that the training they receive is easier to work with than the previous system of work used. The one thing that makes NFPS Ltd stand out is the ongoing support we get. If any advice is needed, Mark Dawes is only a phone call away, and we are able to call upon him at any time to assist us in an issue that we feel requires input into, and most of this is done at no additional cost. The training style used by NFPS is brilliant. Unlike some providers, it is not demonstrative or autocratic. It is totally inclusive. Learners on courses are made to feel very welcome and put at ease right from the start, and I think this is because Mark and John know their subject inside out. Janet Cowie, Group HR Manager, Priory Group.